Okay, here we are with the Rupert family. We have on our right, we have Marcus. In the middle, we have Miles. And on the far left side, we have Maria. And one of my patients, Crystal Anderson, referred the Rupert family into our office. And we're going to talk about what health challenges they were having, and we'll talk about the results of the program that they've been on for the last couple months. So, Marcus, could you tell us about what's been going on with your health? What's been bothering you? How's it been affecting you?
Yeah. When I first discovered I had stomach issues, I was so sick that felt like I was in a constant cold that just never ended every day, and I couldn't think straight. And I was in and out of the hospital seeing different doctors to try and get better, and nothing was helping fix it at all. I just kept constantly feeling sick.
Mm-hmm. And you had been to like traditional medical doctors and the different things that medication, different things wasn't working. With all these things that were going on, how did it get in the way of your life? I think you had some issues where you couldn't go to school for a while. Can you share about how the impact of these chronic digestive issues were having on your personal, well-being and your attitude?
I couldn't sit straight through classes. At some points, I just have to run out and use the restroom. I was feeling so ill that at work sometimes I would start to feel so sick that I would just have to run out and leave, and it was very just distracting throughout the day. Painful stomach pains all day long.
Mm-hmm, mm-hmm. So it got in the way of you being a good student, right? And I think for a period of time you actually missed school, right? You couldn't attend.
Yes.
Okay, so we missed out on some issues with school opportunities. Okay, and how was this affecting your mental health? You're feeling positive about the future.
I was not feeling very positive about it at all. It made me feel like I was going to be in the hospital for the rest of my life.
Wow. Okay, that's a big deal. Okay, and as a result of our program, and we've been working with you on nutritional, changing your diet, finding different inflammatory syndromes that were going on in your bowels and in your other metabolic functions. We also did chiropractic care. We also did some what's called brain-based therapy, where we did things to activate your brain. I think you had a lot of brain fog as well, right? As a result of the program, how has this? What difference have you noticed, and how has it impacted your life?
I feel back to normal. I feel like I can do daily things, and I'm not worried about being in stomach pain. I'm not in the bathroom all day long because I don't know what to do with the pain. I can think and function and not worry about it. The new routine that Dr. Taggart has helped me come up with has kept me feeling great every day.
That's awesome. Appreciate you sharing that. Okay.
You're also back to school.
Back to school and doing feel like
well.
you can focus and doing well in school. That's a huge thing. Now, Miles, you came into the office. Can you share what was going on with you?
I had similar issues to my brother. I was just really sick. I had more highs and lows though. At some points I could tolerate it, but then other days I would wake up in the middle of the night with huge pains in my stomach. Right. On some occasions we almost brought me to the ER at the hospital because I was just feeling so sick, had such tremendous pains. And afterwards after a while I started seeing Dr. Taggart, and cured most of those actually all of those illnesses where I would wake up in the middle of the night with huge pains.
So digestion's a lot better.
Yes.
And energy also went up.
Oh yeah. I also was fatigued at the time before seeing Dr. Taggart, where I could barely stay up throughout my entire day.
Right.
And that was really difficult because that affected my school life, my after school life.
Right, because you're an athlete and you often were tired. All day school and you have to go to practice and you'd be tired, right? And you're not going to perform as an athlete if you're definitely tired.
Yeah.
So you've been a better student, better athlete, overall feeling a lot better. And you had the same medical approach that your brother had, and a lot of different medications and things that it just wasn't getting. There was no improvement, right? It was just the same thing over and over again. And one of the things that's unique about our office is we dig a little bit deeper than most medical doctors will do. And so we have different tests and different ways to figure things out when the medical profession basically just says, hey, it's on these medications for the rest of your life and it's status quo. So we have ways of really finding the true root causes of what's really going on, and as a result, it's helped you a lot. Now, Maria, I'm just curious, as a mom, moms tend to worry about their kids. Prior to seeing your sons in our office, how do you feel like this was affecting you as a mom?
Oh, it was very stressful. Having found out 3 years ago that I have 2 sons, both that came down with the IBS type issues, Crohn's, enteritis, colitis,
inflammation
IBS,
of the gut. Yeah,
right.
Mm-hmm.
And having them treat with Marybridge Children's Hospital was really tough because it's very, very expensive. It's financially draining. It was emotionally draining because the doctors, although great, treated with medications, but my sons would say the medications made them feel not themselves.
Right. Side effects.
Side effects.
Right.
Lots of side effects. Right. Damage to the liver, damage to their growth, and I believe it was Marcus that he felt like they depressed him, so it made him extremely depressed when he took the medications. Miles, when he took the medications, he was extremely lethargic, like sleep for hours. And this is a kid who's go, 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 and never had any problem with energy previous to that. So I would say that treating with Dr. Taggart for the last couple of months, since November actually, has changed dramatically because they're more themselves now, kind of back to the way they were before. And they're not on medications anymore.
Right. In fact, they're doing a lot better. What do you feel like that's done to your stress level?
It's brought my stress level down tremendously because it used to be like anytime I almost talked about this, I'd cry or I'd get upset.
Emotional, so stress level's gone way down. Good. And overall, would you say this program that you've been, how has it affected your family as far as the big picture goes?
Well, I would say, obviously, when you have 2 kids with diseases that are going to last a lifetime, it's going to be hard. But what the hardest part is knowing before Dr. Taggart, thinking this is going to be our life, and they're going to constantly be sick and constantly in the doctors. And like Marcus, he left Eastern Washington University because he was so sick and had to come home. Not sure, now that I have Miles, who's a senior in high school, wasn't sure if he was going to be able to go off to college. So this is affecting their entire life.
It's a huge deal. On a scale of 1 to 10, it's a 10.
Yeah, what they would do with their life in the future. Marcus is back to the University of Washington now, and he's doing great. Miles is looking at, he's gotten into pretty much all of the colleges he applied to, and he's even considering going out of state. Previous to Dr. Taggart, I don't even think I would have considered allowing him to go out of state with the disease. Now, I think it's manageable and he can manage it because he knows how to eat.
Changing diet.
And he knows if he needs help, he can come home and figure out what supplements he would need to take to make him better. But we're learning like what supplements he would need. I almost feel like we could probably figure that out at this point. Maybe even on our own, but with some help from Dr. Taggart, if Miles was far away. But it's changed our lives in many, many ways because I had thought we're going to constantly have to get these endoscopies and colonoscopies. We were doing it every 6 months.
And it wasn't really changing. It wasn't changing.
They are thousands and thousands of dollars. And so now it's like
this healing, the scans are showing that they're actually doing better finally.
And the only reason we got one done recently on Marcus was because the doctor just wanted to see the difference. And there's been a huge difference.
And the medical doctors are kind of like they're kind of shocked. I mean, they're happy, but they're shocked that you're
Right.
doing better because
Right.
with the medical approach, it was just status quo, no improvement,
Right.
just medication
Right.
forever.
They would medicate, they'd
Yeah.
get better, but then they'd get sick again,
Right,
and
exactly.
really super
Right.
sick, and then they'd have to go back on the same medications, and it was
Yeah.
a cycle, every 6 months
Right,
cycle
right.
that
Good.
better, sick, better, sick.
Yeah. Well, we definitely broken the cycle, so I'm really excited for both your sons and for your family because this is one of the taglines of our practice is life-changing care, and based on what you guys are telling me, that's what happened, right? Life-changing care. Good. And Maria, if you knew anybody who had a chronic health condition that was not seeing any results from traditional, medical care, would you be enthusiastic about sending them to our office?
Absolutely. In fact, I
Okay.
think there's already other people that I've already mentioned this to,
Yeah.
just because it has been
Right.
life-changing, and
Yeah.
everyone who knows us knows the boys' story and knows that this
Mm-hmm.
is what we've lived with, and they've seen the changes for themselves.
That's
So
great.
it's
Wonderful.
it's been pretty good thing
Pretty-
for us.
Yeah, very good. Okay, thanks so much for sharing.